Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. As you know, in the playlist I have provided almost all the topics in a very systematic order, and you can also make use of that. And as you know, we were discussing about different issues related to vaccination. We are trying to understand vaccination through different cases. So in that case, so today we'll have another case. See, this is the problem. Now in this case, this is a preterm baby. Okay, this is a preterm baby actually, which is delivered at 30 weeks. So this case is often very useful case in general practice. So preterm baby is delivered at 30 weeks, and the baby was there in the NICU for so many days and underwent so many medications and all those things, and now discharging after 60th day. Okay, 30 weeks, 60th day means almost all 2 months. 2 months means almost all 8 weeks. So it's at 38 weeks. Now the child stayed almost all 8 weeks in the hospital after delivery, preterm baby, and now it is discharging. At the time of the discharge, now the child is 38 weeks old. I think this is very clear. Child is now discharging. At the time of the discharge, the age, that is gestational age of the child, is about 38 weeks of old. The chronological age is different, and this post-conceptional age is different. Okay, now the child is 38 weeks old post-conceptionally at the time of the discharge. But the problem is the weight is still 1.5 kg because it is preterm baby, so delivered with a low weight, and even at the time of the discharge, okay, 38 weeks, it is only 1.5 kg. And there is a history of receiving the blood, and there is also IVIG transfusion because it's a preterm baby. Preterm baby requires so many things. There are so many complications occurring in a preterm baby, like it is a necrotizing enterocolitis and sometimes septicemia. Many things will happen. So this baby also underwent all these problems, and therefore so many medications has been given. Even at times they have, when the platelet count is very down, so they have even given the maternal blood transfusion also. And there is also IVIG, immunoglobulins has been also given. But now child is discharged, child is okay, child is getting discharged now. The question is, the weight is only 1.5 kg. What are the vaccination that we can give at the time of the discharge? What are the vaccination at this juncture? We know all the history, weight is only 1.5 kg. Now, question number 1 is whether we can go for OPV at this particular juncture. At this particular juncture, whether we can go for OPV. OPV is a live vaccine, we know that. Okay, OPV is a live vaccine. Now, the thing is, he can receive the OPV. 1.5 kg baby, preterm. Now, it is almost 38 weeks of gestation. Okay, so now he can receive the OPV because IVIG taken will not cross over the intestine and will not interfere with the OPV multiplication in the gut. When we give the OPV, it will be uptaken in the intestine, isn't it? So intestine will going to uptake it. IVIG, which is given to the baby during the hospital stay, actually it will not cross over the intestine. Okay, from the blood it will not cross over the intestine, so it will not interfere with the OPV uptake. So therefore in this baby OPV can be given. Second question is whether we can go for BCG. Yes, although the weight is 1.5 kg, we can go for BCG because BCG basically deals with the cell mediated immunity. It is not going to do anything with the humoral immunity or a B cell immunity. IVIG is a part of B cell immunity, okay, or humoral immunity. So again, there is no any interference with the immunoglobulins. So therefore you can also safely give BCG in this case. Question comes about hepatitis B, isn't it? At the time of the discharge, we will also give the hepatitis B, OPV, BCG and hepatitis B. Now when we give hepatitis B, now there is a clause. Thing is, when we give the hepatitis B to the baby to a less than 2 kg weight or less than 1 month, irrespective of the weight of the age. That means, see, two criteria are there. To give the hepatitis B, either baby should have more than 2 kg of weight or either the chronological age of the baby should be more than 1 month, okay, irrespective of the weight. So suppose if you give hepatitis B in a baby less than 2 kg or a baby with the chronological age of less than 1 month, then suppose if you give a hepatitis B, the concern is the seroconversion is only 68%. Seroconversion is only 68%. That means it's not completely protected. But if you give hepatitis B to a baby of more than 2 kg and also more than 1 month of chronological age, then the seroconversion is 98%. Then the seroconversion is, that is, baby is well protected. Okay, so this rule came that it should not be given if the weight is less than, therefore because of this fact only, so usually we will have a practice that hepatitis B will not be given if the weight of the baby is less than 1.5 kg and less than 1 month. So in this case what actually happened is the weight is less than 1.5, that is weight is less, weight is only 1.5 kg. Okay, so therefore here what we have to do now, for OPV, for BCG, no problem, but the only problem with the hepatitis B. So if we are giving the baby hepatitis B, if you are giving in less than 2 kg, then we have to give the 4 doses. You can give, and you know that seroconversion is only 68%. So therefore you have to give 4 doses. Usually we will 1, 2, 3, 0, 1, 2 or 0, 0, 1, 2 like that we will give, or sometimes 0, 1, 3 is there. 016 is also there. So different schedules are there. But in this case, suppose if you give it is before, at the time of the discharge, before the baby gaining the weight of 2 kg, then actually we have to go for 4 doses. See, always preterm babies, see why, then you can ask why we have to take such a risk, wait the baby till 2 kg, then only we will give the hepatitis B. The question is not that. Question is more than the term babies, it is actually the preterm babies which actually require the vaccination, because preterm babies are now more vulnerable for the infections compared to the term babies. Preterm babies require vaccine and they are more vulnerable for the infection, and as they have not received any maternal antibodies, this is the main problem. Preterm, it is delivered very early. Okay, yes, 7th, 8th and 9th month the mother transfer her antibodies to the baby, but before that unfortunately baby has come up, baby has delivered. So baby haven't received any maternal antibodies also. Okay, so protection offered is very less. So actually for a preterm baby there is a real need of a vaccination. So when you give the vaccine, they respond better. Okay, when you give the vaccination, preterm babies respond because there is no interference with the maternal antibodies. See, maternal antibodies are not transferred to the preterm baby. It is a plus point and it is also a minus point. Minus point is baby is less protected against so many disorders. Okay, plus point is, suppose if you are giving the vaccine, there will be less interference. Otherwise, whatever vaccine you are giving, the vaccine reaction takes place, immunological response takes place. It has to go through the maternal, it has to face the threat of the maternal antibodies also. Sometimes the immunity may be cancelled because of this fight. Okay, so that issue will not be there. So it is the chronological age that matters, not the post-conceptional age. Okay, so right now, so we have newer recommendations of a IPV also, that is 3 doses. For example, 6, 10 and 14 weeks by National Immunization Schedule. Okay, so this is over. About hepatitis B, it is over. Now we have got newer recommendations of IPV, and for the IPV. So the National Immunization Schedule says that you have to give 3 doses IPV, 6, 10 and 14. Okay, because we have declared that polio has been eradicated. But so oral polio has to be replaced by the IPV, isn't it? So therefore, when you give the IPV now, national immunization recommendation is 6, 10 and 14 weeks. That means along with the DPT or Pentavac vaccine. But IAP has got different opinion. IAP recommends only 2 doses. IAP recommends only 2 doses, that is 6 and 14 weeks. Okay, 6 and 14 weeks. So the last part is an extra. Okay, we have already answered the previous question of, but last extra knowledge, that means extra information I have given. Okay, so this is what exactly you have to give. 6 weeks, 10 weeks and 14 weeks. Pentavac you have to give, then PCV and rotavirus vaccine, then IPV also. Okay, this is according to IAP. Thank you very much. We will meet with another important case in the next class. Till then, goodbye. Don't forget to subscribe to my channel, and also please give your valuable